Hello, and welcome to the League of Women Voters Wichita Metro evening on KanCare with questions and answers with Spencer Culver. I am so excited that you all will be with us tonight to learn a bunch about what expanding Medicaid is, how as a league we're finding more questions and more answers to be able to best understand what we're voting for. Tonight, I have a very special guest with me. Meet Spencer Culver. He is with the Alliance for a Healthy Kansas, and he is an advocacy specialist. So a little bit more about Alliance for Healthy Kansas. They are a statewide coalition working and encouraging and organizing to support policies to ensure that everyone has an opportunity to attain their highest level of health. So welcome. We're so glad to have you here tonight. So what I'm going to do is I'm going to have Spencer share his presentation, and we're going to get started. But I will let you guys know a couple housekeeping items. Sorry, I got you so excited there, Spencer. I'm sorry. A couple housekeeping items. One, if you do leave any comments, that is fantastic. At that point in time, we will answer those questions at the end. So feel free to comment and ask any questions at any period of time, but at the end is when we'll answer them. So go ahead and comment whenever you feel ready, and then we'll have them compiled and ready to go at the end. All right, Spencer, take it away.
Great. Thank you, Kate. I'm glad to be able to be here and do this. I'm going to share my screen now, and then we can get started with my presentation. OK. I'm going to assume that everyone can see this and hear me OK. If not, then we can you can let us know in the comments, and Kate will send me a text, and we will sort that out. So this presentation is titled Kansas Needs Medicaid Expansion, and Our Movement Needs You. I just want to share a little bit about who the Alliance for a Healthy Kansas is before we get into everything. So the Alliance for a Healthy Kansas is a nonpartisan, nonprofit organization. We principally do policy education and legislative advocacy, in addition to some grassroots organizing across the state in meetings like this or meetings of our own. The Alliance is comprised of a coalition of more than 100 organizations statewide who come at this from all different angles, be they healthcare providers, business organizations, faith leaders, or just policy or politically minded organizations that care about civic engagement. In addition to those organizations, we have a network of thousands of individual advocates who are passionate around the issue of expanding Medicaid, helping 165,000 Kansans gain access to health insurance so that they can be healthier individuals. So I just want to get into a little bit of background about Medicaid expansion and what it is. Medicaid expansion is a provision in the Patient Protection and Affordable Care Act, also known as Obamacare. It was rendered optional for states because of a 2012 Supreme Court decision. Originally, it was a requirement of the provision that states would expand eligibility for their Medicaid programs so that low-income Americans would qualify for health insurance. That was ruled unconstitutional, and it was required that states would have to opt into that program. They could begin doing that in 2014, which is when one of our neighbors, Colorado, decided to do that. Ever since then, it's been a debate in Kansas as to whether or not we should expand Medicaid, and it's a legislative discussion and debate that we're still having today. So I guess that's the relevant background on what Medicaid expansion is and where it came from. Just to kind of describe a little bit more about the individuals who are affected by Medicaid expansion, I think this graphic does a pretty good job of doing that. So on the left side of the screen, you will see the Medicaid portion of the umbrella. This, in the state of Kansas, is limited to specific low-income groups. You have to be below 38% of the federal poverty level, which for a family of three is $8,345 a year for a family of three. In addition to that income guideline, you also either have to have a disability that is designated by the federal government, or you have to have children under the age of 18 living at home with you. If you're a childless adult, it doesn't matter. Oh no, you can only see the main screen, not the presentation screen. Let's try and fix this. Hi, I'm back. Kate, do you want to come back up here and try and help me out?
Yeah, definitely. So go ahead and share your screen again. And then if you just want to, you can just kind of click down that PowerPoint presentation slides, even though I know it has the little ones on the edge.
Okay. So I think that the graphics really weren't relevant for the last component. Can you see my screen okay now?
Yeah, we can see everything there. So just keep scrolling down on that side, and I think we should be doing pretty good.
Okay, great. Sorry about that. So if you're a childless adult in the state of Kansas, under the 38% federal poverty level, you do not qualify for Medicaid. Additionally, the other relevant figure is 100% of the federal poverty level. At the point where you're above the poverty level, the federal government provides you subsidies to purchase private insurance on the federal marketplace. So that would be about $21,960 for a family of 3. Those individuals between 38% of the federal poverty level and 100% of the federal poverty level have no affordable coverage options, and they're left in a gap where they don't really have a good opportunity to attain their highest level of health. What Medicaid expansion would do is it would close that coverage gap by providing Medicaid coverage to those individuals so that they could be healthier. Just to clarify a little bit about what these income guidelines are, because it's a little bit complicated, there's this chart that I think can do a good job of illustrating where people are eligible for Medicaid expansion. So take that same family of 3. If that single mom of 2 was earning $8,345 a year, she would qualify for Medicaid. Under Medicaid expansion, she could earn up to $30,305 a year, and she would still be able to gain coverage under the Medicaid program. And those figures are differentiated based on the number of individuals in your household, but it would expand coverage significantly to a group that we anticipate, and the Kansas Department of Health and Environment anticipates, as 165,000 Kansans would be eligible for coverage under Medicaid expansion. So just to provide you some more background on where the state of Kansas is relative to the rest of the United States, I mentioned earlier that Colorado decided to expand their Medicaid program in 2014. As you can see, Nebraska, Missouri, and Oklahoma all decided to expand their Medicaid programs too. Nebraska was first, and then Oklahoma and Missouri did this during the past election cycle in 2020. This puts the state of Kansas on an island, which is particularly problematic for our border communities and healthcare providers, because healthcare providers in Missouri and Oklahoma are going to be able to draw down more federal funds to be able to pay providers a little bit more money. This could pose a challenge for workforce competition and workforce retention, as hospitals or community health centers struggle to maintain qualified staff to provide the best healthcare delivery that they can inside of their clinics or their hospitals. So I think that this is a relevant consideration, that Kansas is one of the last holdout states. So we've been able to look at how Medicaid expansion provisions have affected other states, what the consequences of those are for not only the economy, but people's health. And what we found is that Medicaid expansion has largely been a great decision. There's not been a state that has rolled back their Medicaid expansion programs because it's been so effective. So the next thing I want to go into is what the benefits of Medicaid expansion are, why it is that we ought to expand access to Medicaid. So as I was mentioning, we've had Medicaid expansion in other states for about 6-7 years now. And a review of over 300 research studies has found that more people gain access to healthcare coverage under Medicaid expansion. And with that access to coverage, it means it's easier for them to get care. They have more sites where they can go and see a doctor or seek care for basic preventive screenings or other more serious healthcare complications. In addition to having greater access to care, that care is much more affordable because their provision of the visit would be taken care of by Medicaid. With greater access and greater affordability of care means that people are using care more often. That means we have healthier individuals, they're seeking preventive care earlier, we're seeing reductions in mortality and a number of different conditions, which is pretty significant. The other things that we've seen from Medicaid expansion are that people have reduced medical debt. They're no longer people are no longer going broke from their medical bills that they might get from visiting an emergency room in the hospital. And those hospitals are also seeing reduced uncompensated care costs. So if someone comes into the hospital without health insurance and gets a bill for $10,000, they would probably find it very difficult to pay that $10,000 bill back. And so the hospitals have to write off that debt. Medicaid expansion would provide payment for those services and allow hospitals to reduce their uncompensated care and improve their balance sheet so they're not facing as many losses. Next thing I want to talk about is the relationship between Medicaid expansion and mental health. Right now, I think it's safe to say that mental health is a crisis in the United States more generally, and there's a pretty significant unmet need here in the state of Kansas. So nearly 1/3 of Kansans who are eligible for Medicaid expansion experienced mental illness in some capacity or substance use disorder in the past year. When interviewed or talked to, they identified cost as the main barrier to care. It was just too expensive to get routine and continuous mental health treatment to handle or treat their mental illness or substance use disorder. So of that 1/3 who would be eligible for Medicaid expansion, less than 14% of those people actually received treatment last year. What Medicaid expansion would do is it would meet that need. So people who are enrolled in Medicaid expansion in other states are 30% more likely to receive treatment than people who are not in Medicaid expansion states. It increases access to preventive care, which drives down the cost of care overall and makes people healthier. So it has pretty significant effects on mental health of individuals who are eligible for Medicaid expansion. The other pretty significant effect that Medicaid expansion has is on racial disparities in health. So I think one of the big areas where this is striking is in access to care. So in a report done by a national entity, they found that 67% of uninsured low-income Black Kansans reported not being able to see a doctor because it was too expensive. But in expansion states, that disparity in coverage between Black and white adults shrunk by over 50%. Those are pretty significant numbers, and Medicaid expansion would do a lot in decreasing the disparity in access to care between racial minorities and white folks in the state of Kansas. We've also seen positive effects in terms of health outcomes. In expansion states, Black cancer patients were able to get treatment more quickly, and Medicaid expansion was also found to reduce the disparity in mortality in individuals who had colorectal cancer. They reduced that disparity between Black and white patients, which is pretty significant. I want to shift from the health side of things to the dollars and cents side of things, the financial aspects. So one thing that's relevant to consider with Medicaid expansion is that the federal government makes this a pretty sweet deal for states. They've agreed to pay for 90% of the cost of Medicaid expansion. The state chips in 10%. So for every buck that we put in, the federal government puts in 9, which means that we're able to draw down a lot of federal funds to inject into our economy. And since we've had this opportunity in 2014, our state has forfeited over $4.5 billion in federal funding by not expanding KanCare, which is the name of our Medicaid program. Those are dollars that could have been going toward making individuals healthier, supporting our rural hospitals and mental health clinics to improve the overall outcome and health of our state. In addition to the amount of money that we can draw down from the federal government to make our population healthier, it means more tax revenue because we're hiring more people, which means that we can collect income tax. There are people who will get salary raises, which means they're spending more money. We can get taxes from property taxes if they purchase a new home or sales taxes on the purchase of new goods. An estimate of the amount of money that would be brought in by Kansas if Medicaid were expanded found that it would be between $31 and $39 million per year, which is pretty significant given some of the expected revenue shortfalls the state is facing because of the COVID-19 pandemic, which is, I think, a good transition to what Medicaid expansion can do to bolster the economic recovery of our state. So we expect that Medicaid expansion will inject hundreds of millions of dollars into the Kansas economy from new healthcare spending. We also expect that 13,400 jobs, a little more than that, will be created in the first full year of Medicaid expansion, which is a pretty significant number. And so for a breakdown of how this money would be allocated and where those jobs would take place, you can go to our website at expandkancare.com. And on the banner, there will be an outline of the state with different counties on it. You can click that and you can find our county fact sheets that will tell you how much money is expected to come into a particular county because of Medicaid expansion, how many jobs can be expected to be created, as well as how many individuals will gain access to health insurance because of Medicaid expansion. The other thing is that I already kind of touched on this earlier, that it'll be difficult without expansion to compete with neighboring states for workforce and economic development, because states across our border can just offer a little bit more than the state of Kansas can, because we're rejecting hundreds of millions of dollars coming into our economy. And we've been able to see that the economic effects of Medicaid expansion are pretty significant. I'll highlight a couple of different states, Louisiana and Michigan. In Louisiana, they found that they gained $103 million in new state tax revenue every year and $75 million in new local tax revenue every year, which are pretty significant numbers. In Michigan, I'll highlight the jobs outcomes. There were 30,000 jobs that were created. In addition to that, there was $2 billion of an annual increase in personal income from individuals who freed up money that they were spending on healthcare to being able to spend that money on other things, paying the bills, purchasing clothes for their kids, those sorts of things. So I think that the data from other states has told us that we can expect an economic boom from Medicaid expansion, which is a strong justification for us to do it. The next thing I want to talk about is the effect that Medicaid expansion would have on hospitals, in particular those in rural communities. So a recent national report found that 76% of Kansas rural hospitals are at immediate or high risk of closure due to financial instability. When I talked earlier about reducing uncompensated care from expanding Medicaid, this is how we think that hospitals' financial outlooks could be improved upon by expanding access to Medicaid. They would no longer have to write off as significant of charity care or uncompensated care as a result of individuals without insurance coming into the emergency room to seek care, because individuals would have access to Medicaid, and Medicaid would pay for the cost of their services. So we found that in other states, research on that front has found that expanding Medicaid could very well mean the difference between staying open or closing their doors. This photo next to the text is a photo from Sumner Community Hospital in Wellington, which closed down in March. It was one of the more recent rural hospitals to close down in our state, and we're seeing more hospitals close in our state, which is why I think there's an urgency right now that we expand Medicaid so we can do all that we can and implement a variety of solutions that are necessary to strengthen our rural hospitals and their financial bottom lines. The next thing I want to go into is the sort of legislative background, which I think might be the more interesting component of this presentation, depending on who you are. So the background here is that in 2017, Medicaid expansion passed in the legislature in both the House and the Senate. Then Governor Brownback vetoed that legislation, and we were only a couple of votes shy of overriding that veto. So Medicaid expansion didn't go into effect. In 2018, the House and the Senate committee hearings took place in February. The bill passed out of the Senate committee, but it really just didn't go anywhere after that. It was blocked by leadership from further consideration, which was unfortunate. In 2019, we had a sea change with Governor Kelly being elected, which was a big deal because we knew that if an expansion bill was passed of the legislature, it was pretty likely that Governor Kelly was going to sign it. The downside of 2019 was that leadership in the Kansas House and the Kansas Senate opposed Medicaid expansion legislation. There were no hearings on the bill. There was no really official pathway for it to happen. However, the House was still able to pass House Bill 2066, which was a Medicaid expansion bill. It just wasn't taken up by the Senate, which was an unfortunate outcome of 2019. In 2020, we had a pretty significant breakthrough with a bipartisan agreement between the governor and then Senate Majority Leader at the time, Jim Denning, to expand Medicaid and do a couple of other things that would improve the healthcare landscape in the state of Kansas. Unfortunately, we were met with opposition from anti-abortion advocates and conservative leadership, and the session sort of ended abruptly because of the pandemic. So we didn't really get the opportunity to take action on Medicaid expansion, which was, again, unfortunate. In 2021, we have a much different landscape as a result of the elections that took place in November. The first thing that's worth mentioning about the state landscape is that new legislation has to be introduced. So in 2020, we didn't have to pass legislation in both the House and the Senate. We just had to pass it in the Senate because it already passed in the House in 2019. Here, we have to start from scratch. Additionally, we face the same hurdles with leadership in both the House and the Senate. We expect them to oppose Medicaid expansion. And now, for the first time in recent memory, we're short of a majority in the Kansas House and the Kansas Senate. So we need to do some more significant organizing to get to a place where we have a majority of votes necessary to pass legislation to expand Medicaid in the state of Kansas. The federal landscape is also a little bit different. Right now, there are conversations about new incentives for Medicaid expansion taking place in Washington. There was really good news on that front with a proposal to increase the federal match rate for our traditional Medicaid program for states who decide to expand Medicaid. And that's being considered right now. So what that means is that for states who have not expanded Medicaid that decide to expand their Medicaid programs, the federal government will chip in 5% that they would that the state would spend on their Medicaid program traditionally for a couple of years. We expect that to be in the ballpark of $300 million, which would cover the cost of expansion for a long time. The other thing is that the Biden administration is not as likely to improve detrimental provisions to a Medicaid expansion bill, like a requirement that individuals report the amount of time that they're working to be able to gain access to coverage for the Medicaid program. The next thing I want to talk about is the governor's proposal that was just released a couple of weeks ago. So for the Medicaid expansion component, it's the same basic bill as 2020. There's a small premium. There's a work referral program for individuals to get access to jobs if they are unemployed currently. It will cover individuals up to 138% of the federal poverty level. There's no reinsurance program, which is not really all that relevant, but it was a piece in the last bill in 2020. And there's not going to be a surcharge on hospitals to pay for the cost of Medicaid expansion anymore. The governor's proposed legalizing medical cannabis and taxation on the sales of medical cannabis to pay for the cost of the Medicaid expansion program. It would specifically not allow smoking or vaping of medical cannabis. And I want to say at the outset, as a coalition organization, the Alliance for Healthy Kansas hasn't taken a stance or a position on medical cannabis. We want to have a meeting with our coalition members, which we plan on doing next week, to have a conversation about how we want to approach this issue and what our position ought to be. So right now we're neutral on the position of medical cannabis, but our coalition has come together in support of Medicaid expansion, and we will remain steadfast in that commitment to that issue. So if you want to get more involved on Medicaid expansion and the work that we're doing at the Alliance for Healthy Kansas, you can go to expandcancare.com and sign up for our email lists. You can follow us on social media at Twitter or Facebook. We're just at expandcancare. And the other thing you can do is text KanCare to 52886. This text program is pretty convenient because we'll let you know when there are key votes that are happening so that you can easily email your representative or your senator telling them that you support Medicaid expansion. And it makes it easy because it has a pre-written email that you can just alter and adjust to your own liking. So it says the things that you want it to say. And it will link you up with the right legislator that's matched to where you are registered to vote. The other ways that you can get involved is I think you can make introductions to local groups in your area or community leaders. Send me an email at spencer@expandcancare.com and we can talk a little bit more about this. One of the things that we're trying to do at the Alliance is build deeper relationships with local organizations so that we can A, get to know what's going on the ground, what the level of need is, and B, build relationships necessary to increase our advocacy presence and get Medicaid expanded. The other thing you can do is you can write a letter to the editor or an op-ed in your local paper supporting Medicaid expansion. The third thing that I would suggest is engage in what's called relational organizing. So get your friends to work toward Medicaid expansion. Get them to email their legislators or sign up for texts from the Alliance so they can get more involved in this issue. The data shows us that relational organizing works. You're more likely to respond to requests from your friend than someone you don't know. So get your personal network involved in this issue and try and get them to work toward expanding our Medicaid program. The other way you can get involved is think about your story and try and personalize it. Why are you involved in this issue? Why are you interested in this issue? And think about the effect that that has on any conversation you have with a colleague or someone in your personal network or your legislator, because I think that sort of personal element can make the message a lot more persuasive. So that's the remainder of my presentation. I'm going to stop sharing my screen now and come back to answer some questions and some answers. It looks like we have a handful of comments. So I'm ready to get going on that.
Spencer, this was incredible. I am an optometrist, so I am in healthcare daily, and I felt like I knew a lot about, like, okay, this is what Medicaid expansion is, and this is what KanCare is. But truly, you really outlined things so beautifully. We do have some really great questions. One that somebody had, and I saw an email from y'all earlier today about it, was so she asked a question of just like what the Healthy for Alliance oh my gosh,
Alliance for Healthy Kansas.
Kansas. All of a sudden, my brain, I'm like reading 7 million things on Alliance.
That's okay.
And they're all like jumbling in my brain. So Alliance for Healthy Kansas. And your stance on the COVID relief bill and some of those different incentive programs that have popped up. Tell me more about that and how you guys see that as an opportunity for us to bring expanding Medicaid to Kansas.
Yeah, I think that federal opportunities or federal incentives to expand Medicaid are something that we would like to see to make it more likely that we expand access to the Medicaid program. In particular, this offer to bump the federal match rate for a traditional Medicaid program to the tune of about $300 million is something that we would support pretty strongly and view as a great way for us to expand access to Medicaid. I think a big reason is a lot of opponents to Medicaid expansion worry about the cost to deciding to expand the program, and data from other states has shown that it's mostly budget neutral or even budget positive, but an additional incentive financially for us to expand our Medicaid programs would be significant. That being said, we principally do state-based advocacy work, so we're not involved in a lot of federal work, but we certainly will take any opportunities that we can get to make expanding Medicaid easier.
Awesome. So you talked a little bit about maybe some of the reasons people might be opposed to expanding Medicaid. So Martha asked, so the legislators that are opposed, we talked about how we don't currently, there is not a majority in the House and the Senate that agree with this issue. What are some of their reasonings? What are some things that we should be thinking about to be like, okay, how, not necessarily as a challenge, but ways that we can understand that issue a little bit better?
Yeah, I think that this is a good question. It's one we get pretty often. The cost provision is a significant one, I would indicate. I think that there are a couple of other ones that people talk about. So there, I think is a discrepancy about the labor market, that opponents think that the pathway to individuals getting insurance is through employment, which is certainly one pathway to getting insurance, but data from the Kansas Health Institute tells us that about 2/3 of Kansans who would be eligible for Medicaid expansion are already working. They're just working in jobs that don't provide access to health insurance, or they may not work enough hours to qualify for their health insurance. Say, the floor for getting health insurance is 30 hours, but their manager only schedules them about 28. So they just barely miss that cutoff. And then there are individuals who are eligible for their employer-sponsored coverage, but it's just too costly and they can't make it work. They just can't make ends meet and also pay for their health insurance. So I think that's one argument as well that individuals get into. There's a sort of discrepancy about the scope of government too, whether government ought to be providing health insurance to individuals. And we're of the position that the state is much healthier when individuals have access to care. They're better able to treat their medical conditions. We can control cost of medical care, and individuals can seek mental health care that they may need or physical health care that they may need to get back to work and contribute more significantly to society than they can right now.
No, that's what, and that makes a lot of sense, giving us those kind of really good points of, people that are like, okay, let's not do this, understanding where they're coming from. So what are ways that simple and easy ways for us to you've kind of gone through a couple of those pointers, but kind of going off of those three main reasons that people, typically oppose expanding Medicaid. What are our easy ways to discuss and kind of have like a comeback for them per se?
Yeah.
Okay, what's, kind of a way to challenge them in that?
Yeah, I think that, staying on message is the best way to do that. So we have some guidance that we can share with individuals. We have information on our website. Our county fact sheets, I think, are relevant to point to. So if you're having a conversation with a legislator and they say, I'm worried about the cost here, you can point to data from other states saying, this has been revenue neutral, there's an incentive from the federal government. But really, you can pivot back to the importance that Medicaid expansion would have in the state. It's worth the investment, and we get the money back. So you can see the number of people who would gain coverage. You can see the number of jobs that would be created, and the amount of money that would be increased in annual healthcare spending, which in Sedgwick County they're pretty significant numbers all around in each of those categories. So I think trying to keep it simple is the best way to do it. And you don't need to be an expert on all of these issues. If you have questions, reach out to the Alliance. That's what we're here for. We do public education work on this policy issue. We're happy to provide talking points, data, or just walk you through how to outline and prep for a conversation on the issue.
Awesome. Next question that we have from YouTube is, have any states reversed expanding Medicaid? Like, has any states changed that legislation and reversed any of their decision, or, kind of decreased the scope of Medicaid rather than expanding it, kind of decreased it back down a little bit, even if it's not a full reversal?
The answer to the question is no. No, they haven't. So hi, Jeff. Thank you for your question. Jeff's come to a number of our events. I'm glad to see him here. States haven't reversed their decision to expand Medicaid. They found it to be a particularly effective program. Governor Kasich, a Republican of Ohio, was an early adopter of Medicaid expansion and was really favorable on the programs, that it helped get people healthier and support their hospitals. So I think that's just one example that illustrates the value that Medicaid expansion has. But there are 38 other examples with the states that have expanded their Medicaid programs and haven't rolled it back yet.
Well, that's super helpful, knowing that there's not been any sort of rollback. It really just kind of, it really is a really great way to kind of see and test the waters with other people.
Mm-hmm.
So I have someone that has some more kind of specifics within their question about saying, like, how does the Alliance come to that count of being 3 votes short? Is it off of campaigns? How do you also, because that's like a really big organizing question too, like, how do you guys come to those conclusions there?
Yeah, it's a complicated science. So, we sort of make assumptions based on how people have voted on the issue in the past, and public statements they've made on the issue. These are sort of assumptions that we have. There hasn't been a vote on Medicaid expansion in 2021 yet. So there are a lot of new legislators who we don't know for sure whether they will or won't support Medicaid expansion. But that's our best guess for where we're at on the issue of Medicaid expansion. And I think that is a good starting point for us to continue to organize and try and get more people involved in trying to expand Medicaid.
No, that's awesome. Really unique ways of figuring out how all of these pieces come together as you're a part of an alliance or a coalition that's doing a lot of organizing work and doing a lot of advocacy work there. So from our own League of Women Voters here in Wichita, how does the money that would be gained in job creation compare to what it would cost us as a state? This could be really big number wise. So if you don't have numbers, that's totally fine. You can just kind of in general on that one. Because I was like, all people are like, math, tell me it. And I know sometimes those numbers are too big to think up on the spot.
I'm not a good math person, but I think that job creation is one piece of the puzzle for how the state could bring in revenue from Medicaid expansion. We would also expect to see pretty significant cost savings in the program in the corrections sector in particular. One of our partners, Kansas Appleseed, has estimated that we would save, I think, around $11 million is the estimate. I should double check on that, but I'm pretty sure that's the number. And with more individuals getting on the Medicaid program, the state can collect prescription drug rebates and fill those and get some money to be saved there. So those things, in addition to tax revenue from new hiring and income taxes, people making purchases as a result of it and being able to generate some tax revenue off of that, that's how we would expect to see the money come back on this issue.
In this, as somebody that works in the medical field, I know that sometimes in Kansas we struggle to recruit doctors and healthcare providers and healthcare workers to our region. Do you guys have any data or information on, recruitment opportunities or how other states have been able to recruit more people, or is it something that you've seen but just not any concrete data on yet?
Yeah, that's a good question. I don't want to overreach. Off the top of my head, I'm not aware of any data on physician or medical recruitment as a result of Medicaid expansion. That doesn't mean that there's not any out there. I am not our policy specialist at the Alliance, so I'm not in journal articles all day, every day, as much as that would be a lot of fun for me. But what we have heard from other individuals is that medical providers are finding it a little bit more difficult to retain qualified staff as states near them have expanded their Medicaid programs. They have had, one example is a community mental health center on the Kansas-Missouri border. One of their therapists was recruited by a clinic in Missouri who offered this individual tens of thousands of dollars more in salary to come work at their clinic instead of the one in Kansas, which, if your commute's only 10 minutes more and tens of thousands of dollars, it's hard to say no to that. So the more tools that we can provide our healthcare providers to be able to retain and recruit qualified staff, I think the better we are off. Money and salary is one piece of that picture. It's certainly not the only one, but I think that it would have an impact.
No, that's super, because I know when a healthcare provider is looking overall at kind of how they want to practice and what they want to do, I mean, at the end of the day, you have student loans and bills to pay. That's a piece of that puzzle. So
Yeah.
that's super helpful. I have another question from Susan about just kind of leadership that refused to kind of introduce a discussion on expansion this year. How can we help change their minds? How can we influence those leaders to have this something that comes to the table so that we can have a good discussion on it within the congressional session?
This is, I think, one of the major questions that we have to wrestle with. And I think that it's important for those individuals to hear from their constituents how important it is that we expand Medicaid. I like to say that grassroots advocacy is the art of the possible. It's creating the opportunities and the momentum necessary to pass policy to make people's lives better. And so with enough support from our grassroots base, I think that there's a possibility that we can turn the tides on this issue. But it will take a concerted effort and a great many of us to get involved in this issue, which speaks to the significance of individuals getting involved in relational organizing or helping make introductions to groups like the Alliance for Healthy Kansas, to social organizations that you belong to, so that we can, build those relationships and work to expand our grassroots network to be more effective in the work that we do. But certainly it's an uphill battle with leadership. And one that we're working on.
That's awesome. What are ways, I know that you've shared a little bit about ways that we could get involved with, with Alliance for a Healthy Kansas. What are very easy ways, and not just following a Facebook page, but is there ways to get involved, to talk to, to have better policy understanding within your organization, or becoming a part of, the Alliance so they can really help make an influential difference?
Yeah, a couple of different parts of that question. So I'll start with how you can work to become more informed. We have a bunch of resources on our Facebook page that the League of Women Voters has been commenting in the comments section. So go check out expandkancare.com and click on our resources tab. We have fact sheets for how Medicaid expansion would affect a variety of different issues. In one-page form, we have more in-depth briefs. You can send me an email and I'll answer your questions to the best of my ability at spencer@expandkancare.com. So that's, I think, a good way to get more informed on the issue, is just try and digest the fact sheets that we have and get a better understanding of it. What was the next question? How they can get involved?
With the Alliance for Healthy Kansas, what are ways that they can get involved just beyond liking a Facebook page?
Yes, beyond liking a Facebook page. That's great. So I would say that the two big things would be signing up for our text alerts, which is significant because it makes it easier for you to contact your legislators, and we'll let you know at key times when that's going to take place. So if you're maybe away from your email for a little while, or you haven't checked our Facebook pages, you'll get a text and say, hey, there's an important vote happening on this issue. Click this link and you can easily get in touch with your legislators. So I think that's probably the easiest way for you to get involved at opportune times and make your voice heard. As far as getting involved, in the work that we do to do organizing and grassroots advocacy, I think that you can work to kind of think about organizations in the Wichita area or whatever area you're tuning in from in the state of Kansas that might be interested in the work that we do around Medicaid expansion. We work with a variety of different groups, whether they're business groups or social service providers. We're trying to make inroads into working with law enforcement about mental health and trying to make introductions between those groups and the Alliance, so you can either invite us to come speak to those groups or just try and make an introduction so that we can schedule a meeting and talk about them getting more involved. Would be a great way for us to expand the work toward getting our Medicaid expansion passed.
Awesome. So your email is spencerc@expandcancare.com, correct?
Just Spencer.
Just
the first name.
Spencer. Man, great. I just
We
want
have
to
a
make
small
sure.
team, so
Well,
no need for a
there's
last
not even
initial.
another Spencer. Man, that's awesome. They'll get straight to you.
Mhm.
That's perfect. So as a legislative session begins, what are key times that we should be watching our emails and things of that nature? Or when is the next time that we should be kind of connecting? Is there a vote coming up soon or anything of that nature we should be aware of?
Yeah, that's a good question. I don't exactly know when that moment would be. That's kind of the issue with legislative politics in Kansas is, sometimes you just don't know when things are going to happen. They'll schedule a random hearing on the issue, and those we can kind of usually find a week in advance, and we'll send out an email, maybe send out a text too, and say, hey, you should tune in or submit testimony or write your representative on this issue. But otherwise, it could just happen randomly, and that makes it difficult to plan for us and for you. So I understand the frustration there, but signing up for our communications alerts is a good way to stay informed. So when that does happen, you can take action.
Totally. This is awesome, especially since, as we've seen in our world in the past year, things can change pretty darn quickly. I was fortunate enough to see a bill presented at the rail at the Capitol, so knowing how quickly things can change and how easily just final decisions can be made on the fly. So that is definitely something that for all of our listeners and everybody that's a part of this is signing up for those things will be really helpful if you want to know more. Any last thoughts you want to leave us with? I could see our questions kind of, started tapering down, but what's any last thoughts for us to kind of continue on this path?
Yeah, I think that there are a lot of folks who may be listening to this right now that have been involved in Medicaid expansion advocacy for several years now and might be feeling frustrated or overwhelmed by continuing to do the work that we do to try and expand Medicaid. And I've certainly felt that way. But I think it's important to recognize that letting our foot up off the gas is not going to create more opportunities for individuals in Kansas to get access to healthcare, to get preventive cancer screenings, to get the necessary mental health treatment that they need, or to make it easier for our rural hospitals to stay open during these difficult times that we find ourselves in. So I think recognizing what's going on out in the world as a justification for us to continue doing the work that we're doing. So we're facing declining state revenues. Hospitals are finding it more difficult because they're also facing reduced revenues. Individuals are getting laid off from their jobs and losing their employer-sponsored coverage. So the need is significant right now. And that makes it all the more urgent that we do what we can to advocate for Medicaid expansion so that we can get 165,000 Kansans access to health insurance so that they can lead healthier lives. So keep with it. Try and maintain as much energy and positivity as you can. If you want to talk a little bit more about it or brainstorm some ideas, my email inbox is open. I'm happy to chat with any of you about this. So just feel free to reach out to me.
Spencer, this has been fantastic. I've learned so much today, and I can tell all the people that have tuned in and that will tune in later on while watching this video are going to find a lot of really great information. So let's say you're watching this right now and you go, oh my gosh, somebody else needs to watch this. This video will stay on our YouTube and on our Facebook so that it can be shared anywhere. If you have any questions specifically about a piece of the presentation, you can reach out to us, but most likely we'll refer you back to Spencer. So you can email him directly and from things from there. I know there were some questions earlier about getting those PowerPoint presentation slides. I think Susan had that question. Reach out to Spencer directly and he can kind of get you some more information from there. But if for some reason something's going funky, you can always reach out to us and we can connect you from there.
Yeah.
For all of our leaguers, please make sure that you are looking out for our upcoming annual our February meeting, which is February 28th. So please go ahead and go to our Facebook, which you're on right now, and RSVP to that event and sign up today. And we'll have another Zoom meeting there. So feel free to give us if you have any questions, give us a holler. And thank you so much for joining us tonight. We'll talk to you soon.
Thanks, everyone.